Hello, everybody. My name is Haley Horn, and this presentation is on my fieldwork placement for fall of 2023. I'm a student at the University of Alabama at Birmingham. For my fieldwork placement this semester, I'm at Anniston Fellowship House. I included the address and the phone number. And for their website, it is through the Alabama Department of Mental Health's page. Anniston Fellowship House's mission statement is to provide individualized evidence-based practice in a residential setting to men diagnosed with a primary substance use disorder. So the population that Anniston Fellowship House targets are men with a substance use disorder who are 18 years or older. So they cannot take adolescents, and it is a men's facility. Also noted in here, dual diagnosis. They are a dual diagnosis facility, and a client can be dual diagnosis, but primary substance use disorder has to be the primary. So if they have mental health diagnosis and substance use disorder, and the mental health is primary, they wouldn't be the right fit for Anniston Fellowship House. There are many different services that are provided to clients. Outreach being one of them. The Alabama Department of Mental Health approved placement assessment. Not only does Anniston Fellowship House can they give assessments, but they don't only give assessments for their facility. If somebody was a different level of care, they could also send that out to another facility. And you have to have a state assessment in order to get into the facility. Interim services, individual counseling. All of the clients are assigned a counselor and a case manager. There's also group counseling and family counseling. So when a client comes in on the human service needs assessment, the counselors look at that, the case managers look at that, and there's an option. So if a client wants the family to be involved, there is an option for that. If they don't want their family to be involved, they don't have to. There's also psychoeducation, rational emotive behavioral therapy, which is better known as REBT. REBT is a cognitive behavioral therapy, and it's where you challenge and correct irrational beliefs. There's also peer support offered, and that's where another person in recovery works with the client. Daily living skills, from making your bed, doing a chore, going to work, paying your rent, just learning how to live again in this setting. Medication management, case planning, linkage, employment. Many of the people that come into Anniston Fellowship House might be involved with the criminal justice system, and they might have felonies. There are places that are willing to employ that work with Anniston Fellowship House and their clients. Education. If someone doesn't have their GED, they strongly encourage them to get it, and you can also get it while you're there. Advocacy, monitoring, MAS, nurse self-medication assessment and medical services, and recreation and activity therapy. So at Anniston Fellowship House, there are two different programs, two different levels of care. There is 3.1, which is clinically managed low-intensity residential treatment program, and 3.01, the transitional residential program. So there's many different levels of care. The highest level of care would be 3.7 with medical, and that is a medical detox. So for someone who's trying to stop taking alcohol, opiates, or benzos, so they wouldn't be the right fit for Anniston Fellowship House. The levels also go down to 2 and 1, which 2 and 1 are outpatient. So when you see 3 before the numbers, that means that it is inpatient facility. So 3.5 is a clinically managed high intensity residential treatment program. So that's like a 28-day program per se, and you be in groups all day, every day. So with Anniston Fellowship House, they start at a 3.1. So you can't come in at a 3.01, you have to come in at 3.1. and you're able to work, and you still have groups that you'll attend in recovery meetings, but it's less than a more high intensity program. So you're being slowly acclimated back into the world. So with the eligibility requirements, clients must be male and they have to be 18 years or older. They also have to be abstinent from any psychoactive substance for 72 hours upon admission. So they will have to be able to pass a drug test. Clients must also have a current Alabama Department of Mental Health approved placement assessment that documents a primary diagnosis of substance use disorder. So you have to have an assessment that says you're a level 3.1 to be able to get into Anniston Fellowship House. But as I had said before, they do assessments there. And clients must also meet criteria in 6 dimensions, and I have the dimensions listed here. So with number 1, acute intoxication and or withdrawal potential. This just means that the client is not going to be withdrawing or detoxing off of anything. It also states if there are symptoms, risks, they can be managed at this level. Number 2 is biomedical conditions and complications. The client's biomedical conditions, if present, are stable and do not require continuous medical or nursing care. So say if someone had surgery and they couldn't get out of bed for a couple of weeks, they wouldn't be the right fit for Anniston Fellowship House at that point in time. You have to be able to take care of yourself and do for yourself while you're in treatment. For number 3, emotional, behavioral, or cognitive conditions and complications. As a dual diagnosis capable program, the client's psychiatric condition must be stable and related to a substance use disorder. The client must not pose a risk to himself or others. So as I had said before, so it is a dual diagnosis program, but they have to have a primary of substance use disorder. And they have to be stable on their medication. So when somebody is coming into Anniston Fellowship House, they have to bring a 28-day supply of their medications, giving enough time to get in with the doctor to continue their medications. With dimension number 4, readiness to change. The client's perspective impairs his ability to make behavior changes without the support of a structured environment. The client requires that 24-hour support be available to promote their recovery. The client has recognized relapse potential in their possible living arrangements, and clients verbalizes relapse triggers and dysfunctional behaviors that contribute to relapse. The client is likely to not succeed in outpatient treatment. So when somebody goes to inpatient treatment, it's because they maybe have tried outpatient, or that they've tried to do it at home and they can't stay sober. They've tried to get into recovery, but they continue to have recurrence of use. With number 5, relapse, continued use potential. The client understands his addiction problem, but is at risk of relapse in a less restrictive level of care. Number 6, recovery environment. The client does not have an environment or social network that is supportive of their recovery. The alternative to treatment would expose the client to alcohol or other drug use, unhealthy emotional situations, abuse, or other conditions that would not support substance use or mental health recovery. And that's why the Anniston Fellowship House is conducive to change and recovery. It is a safe environment where the clients are in groups and classes, and they're also able to work. They're monitored 24 hours a day. There's also transitional housing. So with the levels before, the 3.1 and the 3.01, if someone wants to move into one of the 2 transitional houses, they'll move to level 3.01 while they wait on the bed. So referrals are received from a couple of different places. They might be a court referral, an incarcerated individual that has had an assessment done in jail and has been placed on the waiting list. AA or NA fellowships might refer somebody. Ross Recovery Organization and Support Specialists, they get assessments for their peers and they might refer them. The hospital also refers people, RMC Hospital in Anniston. Quality health care workers, health services. It's another place in Anniston that might refer. Medmark Treatment Center. It is a medically assisted treatment facility, and they might see that somebody that is coming there that they do an assessment on needs inpatient treatment. And there's also self-referrals. If someone realizes that they can't do it on their own and they call up to Anniston Fellowship House, they can bring them in to do an assessment. So the things to remember about this agency, these are the things that I thought were pretty important. So Anniston Fellowship House is a state certified treatment facility, and it offers client-centered treatment planning and services to help a person with substance use disorder transition from a destructive lifestyle of substance use to a productive lifestyle of recovery. So when they are working with their case manager, that case manager looks at their goals, their strengths, looks at their weaknesses as well. So it's individualized. Also, you have to have a state assessment for level 3.1 for admission. So if somebody has their state assessment and it says the level 3.01, they can only take them at 3.1. They would have to drop down to that level while in the facility. And they do offer foundation housing or transitional housing, where the client can stay as long as he feels is needed. They have 2 houses. So for me, my role at the agency and primary responsibilities. So my position as an intern and my role is to shadow the social workers at the agency and complete various assigned tasks and aid in the day-to-day operations of the facility. When I first went in, they had me do everything a client did. I went in at 5 o'clock in the morning and I got off at 10 that night. And I attended meditation that the clients attended. I went to the groups that they went to. So now I help facilitate the groups. I answer the phone. I help with intakes. I've been working on their filing system. Anything that I can do to help and learn. So what is exciting for me about the agency placement is getting to work with people with substance use disorder. I myself am a person with substance use disorder, which is in remission. I'm a person in recovery. So I love being able to get to work with others and in a treatment facility. Also learning what goes on inside a state certified treatment facility. So I work for one of the places that I mentioned before, Ross, Recovery Organization of Support Specialists. And I am an outreach worker. I go out in the community and I do outreach. With my peers, sometimes they'll get a state assessment and they might need inpatient treatment. So I'm the person that's, working on getting them to inpatient treatment, even taking them there if I need to, and working on finding them further placement. So I really like getting to be inside the facility and see what goes on inside the facility. I've seen what goes on outside of it, and now I'm learning what goes on inside of it. So I also have a better insight and understanding to where I can explain to my peers when they ask me, what's it going to be like? What is treatment going to be like? I've never been before. I can explain it to them and tell them now. So the greatest challenge, I'm very passionate about working in the field with people with substance use disorder. I feel like I'm gaining a lot of knowledge from working at Anniston Fellowship House. My only concern is going back to work full-time and doing field work, which I have started to do now. I've done much better than I thought I would with 55 to 60 hours a week. And I'm hoping when I move to 70 hours a week, I can stay focused. I've been making sure I have a day off to practice self-care. I've been being disciplined with going to bed at a certain time when not working and getting up at the same time. I've been praying more and spending a longer time meditating for my recovery because it has to take priority over everything. My recovery is the only reason why I have everything I have today. And it has been a struggle for me with my job, working on the front lines with people who are just coming out of addiction. And working in the treatment facility as well. So I'm constantly working in the field. So it has been a challenge, but I believe I've been able to persevere and do the best that I can do through it. And I'm making sure that I take time for self-care because I know that is huge and I don't want to be in the stages of compassion fatigue or burnout. But that is it for my presentation. Thank you all for coming. Thank you.